Many older adults don't realize that what they wear to a doctor's visit can actually slow down exams, affect vital readings, or make the whole appointment more uncomfortable than it needs to be. And surprisingly, the most common mistake isn't what people expect. It's a simple clothing choice that quietly makes medical care harder for everyone involved. As we grow older, mobility shifts, circulation becomes more sensitive, and doctor visits happen more often. So clothing plays a bigger role than most people realize. Tight or complicated outfits can make exams harder, slow down vital checks, or worsen swelling. Comfortable, accessible clothing helps healthcare professionals work efficiently and allows you to move, breathe, and communicate without strain. The right outfit can turn a stressful visit into a smoother, more respectful experience. Mistake number 1. Wearing clothing. That's too hard to remove. Many older adults don't realize how much time and discomfort complicated clothing can create during a medical visit. Outfits with multiple tight layers, stiff jackets, tricky buttons, back zippers, or form-fitting tops can make simple procedures like checking blood pressure, listening to the lungs, or examining mobility take twice as long. What seems like a stylish or normal choice at home becomes a stressful challenge in the exam room, especially if stiffness, arthritis, or limited shoulder range makes quick undressing difficult. Hard-to-remove clothing can also unintentionally increase anxiety. When a doctor or nurse has to wait while you struggle with a zipper or try to wiggle out of snug sleeves, the pressure rises. It disrupts the flow of the appointment and may even lead you to skip mentioning symptoms because you don't want to remove something again for a second check. For older adults who already deal with joint pain, swelling, or reduced grip strength, these small obstacles add unnecessary strain. What many seniors don't consider is that restrictive clothing can affect how accurately certain checks are done. Tight sleeves interfere with proper blood pressure readings. Heavy layers prevent accurate stethoscope placement. Stiff fabrics make posture, breathing and shoulder movement harder to assess. These small details can influence how clearly a provider understands what your body is telling them. A simple shift can change everything. Choose clothing that respects your comfort and supports smooth care. Soft, loose-fitting tops that open from the front, whether through lightweight buttons, snaps, or a gentle zipper, make exams faster and more dignified. A cardigan that slips off easily always works better than a thick pullover. Pants with elastic waistbands reduce the effort required during weight checks or mobility assessments. Fabrics with a little stretch allow you to move freely without pulling at tender joints. Think of your outfit as part of your healthcare strategy. The easier it is to remove, the quicker your doctor can examine what they need, and the more comfortable you'll feel throughout the process. Little adjustments help you stay relaxed, reduce physical strain, and keep the focus where it belongs, on your well-being, not your wardrobe. Mistake number 2. Choosing footwear that increases fall risk. Footwear might seem like the least important part of getting dressed for a doctor's visit, but for many older adults, the wrong shoes can turn a simple appointment into a dangerous situation. Clinic floors are often smooth, polished, and slightly slippery, designed for easy cleaning, not stability. Shoes that once felt fine at home can suddenly become hazardous the moment you step into a medical building. The biggest issue is that many seniors unknowingly choose shoes that don't support the balance changes that come with age. This includes loose slip-ons, backless sandals, worn-out soles, smooth-bottom dress shoes, and even overly cushioned footwear that makes you feel unstable. When balance is already affected by weaker muscles, slower reflexes, or medications that cause dizziness, these shoes add unnecessary risk. A small shuffle, a pivot, or a quick step when your name is called can be all it takes for a fall. Another overlooked danger is that unsafe footwear can make routine medical tasks more difficult. If you're asked to step on the scale, walk down the hall for a mobility check, or rise from a chair, slippery or unstable shoes can cause hesitation or wobbling. This not only affects safety, but can also give healthcare providers an inaccurate picture of your true mobility. A moment of slipping can make it seem like your gait is weaker than it really is, leading to unnecessary worry or tests. Loose shoes are especially risky when swelling changes foot size throughout the day. A pair that fits in the morning may feel sloppy by the afternoon, increasing the chance of tripping. Backless shoes offer no heel stability, which becomes a problem during quick movements. Smooth soles act like skates on polished clinic floors, and shoes with worn-down tread stop gripping the ground entirely. All of these issues create hazards that most seniors only recognize after a close call. Fortunately, one small change can eliminate most of these risks. Choose footwear designed for stability, not style. A secure, closed-back shoe with a non-slip rubber sole provides the grip needed on slick floors. A lightweight walking shoe with slight cushioning supports both comfort and balance. Velcro straps or simple laces help keep shoes snug on days when swelling or stiffness makes fine motor movements challenging. Good footwear doesn't just prevent falls, it supports confidence. When you walk into the clinic feeling steady, every part of the appointment becomes easier. You can step onto the scale without worry, move through hallways comfortably, and focus fully on your health. Proper shoes make the visit smoother, safer, and far less stressful, ensuring every step you take supports your well-being rather than putting it at risk. Mistake number 3. Wearing thick or bulky clothing that affects vital readings. Many older adults bundle up for doctor's appointments without realizing that heavy, padded or layered clothing can directly interfere with the accuracy of medical readings. Thick sweaters, fleece pullovers, oversized coats, and insulated jackets feel comforting, especially in cold weather, but they create a barrier between you and the medical equipment that needs direct contact with your body. This can lead to inaccurate results, repeated measurements, and longer, more frustrating appointments. One of the biggest issues is how bulky clothing affects blood pressure checks. A cuff that's placed over thick fabric can squeeze unevenly or register a number much higher than your true blood pressure. This can lead to unnecessary concern or even changes in medication based on a reading that doesn't reflect your real health. Many seniors are surprised to learn that even a slightly padded sleeve can distort the numbers. Some clinics require patients to remove layers because staff know how drastically these readings can be affected. Thick clothing can also interrupt heart monitoring. When a nurse needs to listen to your heartbeat through a stethoscope, fabric insulation muffles the sound, making it harder to detect subtle irregularities. If you're wearing a bulky coat or sweater, they may need to adjust or repeat the check multiple times. This adds extra steps, delays, and discomfort, especially if the exam room is chilly or you struggle with stiff joints. Mobility assessments are another area where heavy clothing becomes a problem. If your doctor asks you to turn, lift your arms, bend, or walk a short distance, padded clothing can restrict movement more than you realize. The bulk of it can make you appear less flexible or slower than you truly are. A stiff jacket can limit shoulder mobility, while thick layers around your waist can affect balance or stride. Inaccurate mobility impressions may lead to unnecessary referrals or tests simply because your outfit didn't move with you. Even temperature checks can be affected. When you're wrapped in warm, insulating layers, your body temperature may temporarily spike from trapped heat, making it harder to identify whether you have a true fever or just came in from the cold. Medical staff often ask seniors to remove coats for this reason. The easiest solution is to choose lightweight layers that keep you comfortable without interfering with your visit. Opt for a soft, breathable long-sleeve shirt or a thin sweater that's easy to pull up or remove. Bring a light, easy-to-open jacket instead of a heavy winter coat. If you tend to get cold easily, keep a small scarf or wrap in your bag that can be removed quickly when measurements begin. This simple wardrobe shift ensures your medical team gets accurate readings the first time, saving you from repeated checks, unnecessary stress, and longer appointments. Wearing lighter, more flexible clothing lets healthcare providers focus on your real health, not what your thick garments are hiding. By choosing comfort that works with your body instead of against it, you set yourself up for clearer communication and better care every time you walk into the doctor's office. Mistake number 4, wearing clothes that hide skin. Symptoms. Many older adults choose clothing that fully covers their arms, legs and feet when going to a doctor's appointment. Long sleeves, layered pants, compression-like hosiery and tight garments may feel modest, warm or supportive, but they can unintentionally hide symptoms that doctors urgently need to see. Skin is one of the clearest windows into overall health, especially in later years, and when it's covered too tightly or too much, important clues can go unnoticed. Conditions like swelling, discoloration, dryness, bruising, rashes, pressure marks, slow-healing wounds and circulation changes often show up on the skin first. These early signs help healthcare professionals identify issues such as heart problems, diabetes complications, poor circulation, infections, nutritional concerns, or reactions to medication. But if the doctor can't easily observe these areas, the appointment may become less efficient, or worse, certain conditions might be missed entirely. Many seniors wear multiple layers to stay warm, unaware that layers take time to remove and can discourage a full examination. Others choose tight stockings or leggings that compress the skin, flattening symptoms and making swelling or discoloration harder to detect. While these items can serve a purpose, especially for those who need compression wear, they can also mask subtle signals doctors rely on. Even loose long sleeves may make it difficult for a doctor to assess arm swelling, skin temperature, or certain neurological responses. When skin is covered, medical providers may avoid requesting a full inspection out of respect for comfort and privacy. Some symptoms remain unseen simply because they weren't easy to access. This creates a communication gap. The patient may assume everything looks normal, while the doctor is unaware of what's hidden beneath the fabric. There's also the challenge of tightly fitted clothing, creating marks that mimic health issues. Socks with strong elastic can leave deep impressions that resemble swelling. Very snug tights may cause redness that looks like irritation from something else. This can complicate assessments, adding confusion instead of clarity. The best solution is to choose clothing that allows the doctor to examine key areas quickly and respectfully. Opt for soft, loose-fitting garments that can be rolled up easily. A lightweight top with sleeves that slide above the elbow is ideal. For bottoms, consider pants with a relaxed fit that can be pulled up to the knee without discomfort. If you prefer hosiery or support socks, bring a pair that's easier to remove before the exam. For those concerned about modesty, wearing flexible clothing doesn't require exposing more than you're comfortable with. The goal is accessibility, not revealing attire. A cardigan that opens in the front, pants with gentle stretch, and a breathable layer underneath allow you to stay covered while still giving the healthcare provider proper access when needed. This thoughtful balance helps your doctor see what they need to see without making the appointment feel intrusive or stressful. You remain comfortable and dignified, and your doctor gains a clearer picture of your health, leading to more accurate evaluations and better care. By choosing clothing that supports visibility where it matters, you ensure your body's signals aren't hidden, overlooked, or misinterpreted. Mistake number 5. Wearing clothing that triggers temperature. Discomfort. Many older adults underestimate how much temperature affects their comfort and stability during medical visits. Doctors' offices are notorious for fluctuating climates. One room may feel chilly, another slightly warm, and exam areas often run cooler for equipment and staff comfort. For younger people, these shifts are minor annoyances. But for seniors who naturally experience changes in circulation, thinner skin, and difficulty regulating body temperature, the wrong clothing can create real problems. Heavy, heat-trapping fabrics like wool, polyester blends, or thick fleece can cause overheating the moment you step into a warm waiting room. This sudden heat can lead to sweating, dizziness, or a sensation of breathlessness. Symptoms that not only add stress, but may also mimic medical conditions you're trying to evaluate. On the other hand, overly thin or drafty outfits can make the cold exam rooms feel unbearable, causing shivering, muscle stiffness, and anxiety during testing. When your body is tense or uncomfortable, blood pressure can rise, breathing can feel irregular, and mobility tests may reflect stiffness rather than your normal ability. Temperature discomfort also makes conversations harder. If you're too cold, your focus narrows. You're thinking about getting warm, not about asking the right questions or remembering what the doctor says. If you're too hot, concentration drops and irritability grows, making communication less effective. These small moments matter because appointments are short and clarity is essential. Choosing fabrics that are either too insulating or not insulating enough can disrupt your entire visit. Some outfits trap heat so aggressively that even a few minutes of walking through the clinic can feel overwhelming. Others allow cold air to reach your skin instantly, leaving you chilled long before the exam begins. This discomfort often goes unspoken, but the body reacts strongly, especially in older adults who are more sensitive to temperature shifts. The solution is to dress in breathable, adaptable layers that can be adjusted quickly depending on the temperature. Natural fabrics such as cotton, bamboo, and lightweight knit materials help maintain a balanced body temperature. They release heat when the environment is warm and provide gentle insulation when it's cool. A soft, long-sleeved top made from a breathable fabric, paired with a light outer layer like a cardigan or wrap, offers flexibility. These pieces can be added or removed without hassle, allowing you to regulate your comfort throughout the visit. Avoid thick sweaters, heavy coats worn directly against the skin, and fabrics that cling when warm or feel icy when cool. Instead, choose items that create comfort rather than trap discomfort. Loose-fitting layers also make it easier for healthcare providers to perform exams without you needing to change completely or struggle with awkward clothing adjustments. Another smart approach is to bring a compact, lightweight shawl or wrap. This keeps you warm while waiting, but can be removed quickly when entering an exam room. It provides a sense of security, especially for seniors who feel drafts easily. By selecting outfits that help you stay comfortable regardless of temperature shifts, you reduce stress, maintain steady vitals, and stay present during conversations. Comfort creates clarity, and the right clothing makes every appointment smoother, safer, and more productive. Mistake number 6. Wearing items that interfere with medical equipment. Many older adults show up to appointments wearing everyday items they never think twice about. Belts, metal accessories, firm shapewear, or tight waistbands. While these may seem harmless, they can quietly disrupt medical exams, delay procedures, or lead to inaccurate readings. As we age, appointments rely more heavily on imaging, monitoring, and physical assessments, making the clothing we choose more important than ever. Metal accessories like large belt buckles, decorative buttons, jewelry, or metal-structured hats can interfere with X-rays, ultrasounds, EKGs, and even physical exams. A single metal piece on your waistband can obscure imaging results or force the technician to repeat the scan. Repeated imaging means longer appointments, more radiation exposure in some cases, additional discomfort, and rising frustration. What should be a quick, simple check becomes a time-consuming process simply because of one piece of clothing. Tight waistbands are another hidden issue. For seniors dealing with digestion changes, bloating, or sensitivity around the abdomen, restrictive clothing can make palpation tests uncomfortable and reduce the accuracy of abdominal exams. When the area is compressed, muscles tense, and the provider may misinterpret firmness or tenderness. Something as simple as a snug elastic band can turn an easy exam into a painful or unclear one. Shapewear presents an even bigger challenge. While many older adults wear it to feel secure or supported, it compresses the midsection, hips, and sometimes even the rib cage. This compression can affect breathing patterns, especially during pulmonary assessments, and alter posture during mobility tests. In imaging, shapewear often must be removed entirely because it hides lumps, swelling, or subtle changes the doctor needs to see. Removing it in a rushed clinic environment is stressful, awkward, and disruptive. Even belts can complicate things more than people expect. Beyond containing metal parts, belts restrict natural movement during examination of the spine, hips, and gait. Healthcare providers rely on observing how your body moves without limitation. A belt pulled tightly around the waist can force an unnatural posture, affecting balance checks, fall risk assessments, and even routine flexibility tests. What makes these mistakes even more frustrating is that most seniors wear these items out of habit, not intention. They aren't trying to make exams harder. They simply haven't been told how much clothing impacts medical equipment and evaluation. And because older adults often have more frequent tests, anything that causes delays adds unnecessary stress to an already tiring process. A practical fix starts with choosing clothing that is metal-free, flexible, and easy to adjust. Soft, elastic waistbands that aren't too tight allow more natural abdominal movement and make both physical exams and imaging smoother. Pull-on pants made with cotton or jersey material offer ideal stretch without compression. Loose tops without metallic decorations eliminate the risk of interference with chest imaging or EKG leads. If you like wearing accessories, keep them minimal and removable. A simple strategy is to wear jewelry only if it can be taken off quickly. Avoid anything with hooks, clasps, or multiple pieces. Instead of a belt, opt for pants with a gentle drawstring. And if you use shapewear for stability, consider switching to soft support garments or lightly structured underlayers that don't compress the abdomen. The goal is not to change your style, but to reduce obstacles during appointments. Wearing the right clothing ensures medical staff can do their job efficiently, minimizes discomfort, and helps you receive clearer, faster, and more accurate results. With one small wardrobe adjustment, every visit becomes easier, not only for your doctor, but especially for you. These 6 clothing mistakes may seem minor, but they slow exams, affect test accuracy, and create unnecessary discomfort. Choosing easier-to-remove layers, safe footwear, lighter fabrics, visible skin areas, temperature-friendly outfits, and metal-free, non-restrictive items makes every medical visit faster, safer, and far more comfortable for older adults. Take a moment today to review your doctor visit outfit and make at least one smart change. Small adjustments can make appointments quicker, safer, and more comfortable. Subscribe for more practical tips to improve your daily life, health, and confidence as an older adult.